What is rib remodeling?
Rib remodeling is a procedure that will get you absolutely snatched. It's a minimally invasive procedure, and what I do is I go in and I just make a small little alteration in your ribs. And by wearing a corset, it will cause that waist to come in over the ensuing months, but it will have that waist looking right.
With rib remodeling, are you removing the ribs?
Oh, heck no. I would never remove the ribs. I don't feel like that's very safe. But with rib remodeling, I just bend them in just enough to give you that snatched waist.
And how small are the incisions?
So I actually just use a small needle to get down to the rib and access it and then cause a small little break. I don't use any large incisions because those will be visible and it gives away signs that you've had surgery. So tiny, tiny needle point incisions.
And how much time off work do you need, and what are the restrictions?
It kind of depends what you do. Most people on average take 2 weeks off of work. If you have a job where you're not doing any heavy lifting, then you may be able to go back sooner. The major restrictions are no heavy lifting for about 2.5 months. Anything over 10 to 15 pounds, we say let somebody else do it.
How many inches on average do you see the waist go down?
With my rib remodeling alone, you'll see on average 3 to 4 inches. If you combine that with lipo, you may see upwards of 5 to 8, depending on how much fat is removed.
How long do you wear the corset for?
The corset must be worn around the clock. We recommend 3 months for best results. Those who are more compliant with wearing the corset get better results. It's that simple.
For rib remodeling, does it hurt?
You actually are having some alterations done to your ribs, so you will have some discomfort. I've had some patients who take no pain medicines post-op and some that take it for 3 or 4 days.
Who is a good candidate for rib remodeling?
Great question. So the best candidates are people who are not overweight and don't have a lot of intra-abdominal or internal fat. Because if you have those things, then you're not going to get the results that you want. I have a lot of patients that come to me that had lipo, they've had tummy tuck, but they still don't have that narrow waist they want. They're excellent candidates. At the same time, we have people who will come and do lipo BBL, and ribs at the same time. So being a young, healthy, when I say young, I mean, somewhere in the early 20s, kind of that late 40s range is ideal.
Do you have a BMI requirement?
In general, we like to say the BMI 28 or less is going to get the best results. We do this procedure if your BMI is upwards of 30, but you may not see as much waist reduction as you're hoping for.
And who would you say is not a good candidate for rib remodeling?
Patients that have a lot of visceral fat, people who are not wanting to be compliant with the corset, those patients are absolutely not good candidates for surgery.
With the rib remodeling, can it be done awake, or is general anesthesia required?
We always use general anesthesia for safety. Since we are working in an area that's close to your lungs, we don't want you moving or being startled, so it's better for your comfort and for safety to do this procedure all the way asleep under general anesthesia. On average, it takes about an hour or less. Come get snatched up. How much does it cost?
No.
Free to the first 10 people who
No,
consult at
no,
drundermarshall.com.
no.
Free 99.